The reason that PARP inhibitors may be an attractive option in BRCA mutated early breast cancer is that often women who have these inherited mutations in BRCA1 and 2 do develop forms of breast cancer that can have higher risks of recurrence and need to have drugs like chemotherapy drugs to reduce those risks. But for some patients, there are continued risks of recurrence, and we need novel and more targeted treatment approaches to improve those outcomes. A PARP inhibitor approach is designed to, in a selective way, target a weakness in DNA repair within the cancers that develop in those who've got inherited mutations in BRCA1 and 2, and do this in a selective way that can have a maximum effect on the tumor cells, reducing recurrence risks, but relatively less side effects. And so OlympiA tested whether the addition of a PARP inhibitor to the treatment strategy of women with genetic breast cancer caused by BRCA1 and 2 would add value in those at higher risk, sufficient risk to need chemotherapy, but with some remaining risk. The most important findings of the OlympiA trial are that a year of olaparib tablet therapy compared to a placebo reduces the risk of events that we call invasive disease-free survival events that are a combination of recurrences of invasive breast cancer within the breast or regional lymph nodes, distant recurrences of breast cancer, the development of other cancers, or death from any cause. So this invasive disease free survival was significantly better with a hazard ratio of 0.58 than in the placebo arm. So that means a 42% reduction in the risk of those events. And there was an absolute difference in the IDFS rate at 3 years of 8.8%. What is additionally significant is the secondary endpoint of distant disease-free survival. So that is recurrences of metastatic breast cancer, as well as the occurrence of other cancers or deaths from other causes, was also reduced by olaparib in comparison to placebo. And in that situation, the estimated 3-year distant disease-free survival rate was improved by 7.1%, and that both of those were highly statistically significant, sufficient to lead the Independent Data Monitoring Committee to recommend to the steering committee we report the study at this early interim analysis time point. It's very important we continue to follow the study patients, and this is continued blinded follow-up, double-blinded follow-up, so that we can follow overall survival and monitor side effects in the long term, and that is ongoing. The OlympiA trial results could change the standard of care in early breast cancer with sufficient risk to require chemotherapy in patients who have germline mutations in BRCA1 and 2 by adding an additional therapy for those patients, for a targeted therapy with a PARP inhibitor for a year to reduce those risks. Now, this obviously would require a regulatory approval, and the pharmaceutical companies involved with olaparib, AstraZeneca and Merck, look forward to discussing the results of this trial, which is an academically led trial with industry partners. They look forward to discussing the results of the trial with global authorities with regard that potential indication. Obviously, it does raise the question, a study like OlympiA in the adjuvant setting as to whether there may be other possible uses of olaparib in this adjuvant setting in breast cancer and potentially in other cancer types. At present, there is obviously a lot of interested discussion around this, and there has been for some time the consideration of the use of PARP inhibitors, whether olaparib or other PARP inhibitors in neoadjuvant therapy designs in combination with other drugs. And so, yes, indeed, there are ideas around how other studies could be conducted, but I think many of those are in an early stage of discussion and are clearly stimulated by the results reported at ASCO for OlympiA. OlympiA has been a global collaboration between academic groups around the world and the NCI CTEP groups with NRG, coordinated by the Breast International Group and with industry partners AstraZeneca and Merck, that has allowed us to achieve a trial recruiting a relatively less common group of patients with breast cancer, those who have inherited mutations in BRCA1 and 2, and we're very proud to have achieved this trial and to be able to have presented these results of a global initiative at ASCO 2021.